What are leg spider veins and what is the best treatment? In this video, I give you all the important facts you need about leg spider veins, and I will tell you about microsclerotherapy, which is currently the best injection treatment for leg spider veins and blue veins. Now, if you're new to my channel, make sure you click that subscribe button and all the links in the video description box below. So let's get started, and please stay to the end where I will share with you a detailed resource about everything you should know about leg spider veins. Leg spider veins are unsightly vessels in the skin measuring up to 1 millimeter in size. They're also known as thread veins or broken veins, but the medical term for these veins is actually telangiectasias. Now, many doctors and nurses, as well as members of the public, often regard leg spider veins as just cosmetic, trivial in nature and of no health consequence. For this reason, many people with leg spider veins seek treatment in a cosmetic clinic or sometimes even in a beauty salon. But of course, vein specialists know that leg spider veins are never just cosmetic. Recent research confirms the importance of identifying and treating the underlying cause of the spider veins, which are feeder veins with faulty valves, and I'll come on to that in a minute and explain what that is. Now, the treatment involves the injection of a prescription medicine into the veins, and for these reasons, people with leg spider veins should be carefully assessed and to have proper medical investigations before treatment. And of course, these injections should be carried out by properly trained healthcare professionals who are competent and who are regulated to prescribe medicines. And that means doctors, nurses, and healthcare professionals who are independent prescribers. So, what causes leg spider veins? In my practice, the majority of people asking for advice or treatment are women. Of course, men get them too, but because men have hairy legs and tend to wear trousers, spider veins are more of a concern to women than men. Young women with no symptoms usually have no underlying issues with their veins underneath the skin, and they can have their spider veins treated straight away. These sorts of spider veins are called idiopathic. Women who have symptoms, such as leg throbbing, swelling, or leg discomfort, are more likely to have an underlying vein problem or even varicose veins. In this situation, the spider veins are said to be secondary. Now, this is an important point because people with so-called idiopathic spider veins can have those spider veins treated pretty much straight away, whereas people with secondary spider veins are best advised to have a full duplex ultrasound scan of their leg. In fact, many specialists think that all people who are undergoing treatment for spider veins should have a full duplex scan because it's often very difficult to separate those people whose spider veins are idiopathic and those who are secondary. So for most people, it is the unsightly appearance of their spider veins that causes embarrassment, poor self-esteem, and lack of confidence. And this is often the motivation for seeking help. For others, symptoms such as leg ache, throbbing and swelling may be the concern. And an important fact here that you should know is that spider veins around the ankle usually indicate a major problem with the function of the veins below the skin. And these spider veins should always be taken seriously. The medical term for spider veins around the ankle is corona phlebectatica, also known as an ankle flare. So in most cases, spider veins around the ankle actually indicate a health problem, and they should be taken seriously. These spider veins around the ankle appear because of damaged or faulty valves in the vein circulation. In advanced cases of corona phlebectatica, the skin becomes thin and white and is particularly vulnerable to injury and ulceration. Corona phlebectatica, with these white skin changes, which are described as atrophy blanche, are warning signs of the risk of developing a leg ulcer. So how can spider veins be treated? Well, people with no symptoms, no ankle flare, no varicose veins, and no reflux on duplex ultrasound scan can be treated directly by microinjections, also referred to as microsclerotherapy. Microsclerotherapy involves the injection of a prescription medicine into the spider veins. Microsclerotherapy is a very delicate injection procedure and it requires skill and accuracy. The medicine that is injected into the spider veins is called a sclerosant, and it works by removing the delicate lining of the spider veins, and it starts a healing process in which the vein fades and disperses. Leg spider veins are situated actually in the skin, and they measure up to 1 millimetre in size, and because they are located in the skin, they're obviously easily seen, they're visible. Because no one likes the look of a leg spider vein, it's easy to forget that in nearly 90% of people with leg spider veins, an underlying vein problem can be identified as the cause. And so whilst it's tempting to just inject them, this is very rarely the right way to proceed. We now know that spider veins are connected to the deeper veins. We also know that these veins which connect the spider veins to these deeper veins have delicate folds in the lining which open and close to keep the blood flowing in the correct direction. These delicate folds are called valves. They are easily seen in the larger veins on ultrasound. However, in the smaller veins, these valves can't be seen very easily, and it's only as a result of detailed research over many years that we actually know that they are present, and we now understand that even small veins just under the skin have these delicate folds and one-way valves, and they're referred to as microvalves. Now, the blood in the spider veins in the skin, under normal circumstances, would drain from the skin to the deeper veins in so-called reticular veins, and the blood would be carried away from the spider veins. However, these microvalves do not actually work properly, and there's a back pressure of blood, and this is what actually causes the spider veins to appear. So in this situation, the reticular veins become feeder veins, and if these feeder veins are not treated, then injecting the spider veins directly is actually likely to be ineffective, or it can actually make the veins look worse. So what tests should be carried out before leg spider veins are treated? Well, success when treating leg spider veins depends on careful patient selection. That means excluding unsuitable patients based on health criteria, excluding unsuitable types of spider vein based on the causes, and advising people who might be expecting perfection that perfection is not possible. People who are suitable for microsclerotherapy are selected after a history, examination, special tests such as a duplex ultrasound scan, near-infrared imaging, cross-polarized photography, and transillumination. And with all of these tests, we can get the very best results. So, what are the results of leg spider vein treatment? Well, microsclerotherapy has been studied in many large randomized controlled trials, and improvement of more than 90% is achieved in the majority of people. The European Guideline Group has recommended that liquid sclerotherapy, that's microsclerotherapy, is the method of choice for C1 telangiectasias and reticular veins. Now, as I've said, sclerotherapy depends on a healing process that takes time. The results are not instant. So what are the risks of leg spider vein treatment? Well, serious complications such as deep vein thrombosis, DVT or clots, allergic reactions or infection are very rare indeed, much less than 1 in 1,000 risk. You will get some discomfort and stinging at the injection sites, and some people experience restlessness in their legs during the first few nights. For a month or so, the veins may actually appear more prominent and the injection sites may itch for a few days. But serious complications are very rare. The solution can sometimes escape from the veins, and it can cause inflammation in the skin and the surrounding area, and there's a small risk of the development of a tiny ulcer which may leave a pink or white scar after healing. After treatment, there may be persistent veins which are resistant to injections. The treatment may cause brown discoloration. It usually fades by 6 months. It's usually gone. But it can sometimes persist and take up to 3 years to fade completely. Very rarely, and this tends to happen only if a duplex ultrasound scan has not been performed, and it sometimes happens if the feeder veins are not identified and addressed, microsclerotherapy can make the veins worse, or even new veins can appear. Now, sclerotherapy can sometimes bring on a form of migraine which leads to temporary visual disturbance for a few minutes or a few hours after microsclerotherapy. If it's going to occur, it usually happens in people who suffer with migraine anyway. It's very rare in people who don't suffer with migraine, and it tends to happen in the clinic during the injections. It doesn't happen the next day or a few weeks after. In addition, those who are susceptible to migraines may actually get a full-blown migraine with a very bad headache. So there you are. That's everything you need to know about the treatment of leg spider veins by microsclerotherapy. It's a long video. Thank you for staying to the end. As promised, if you would like to know more, please visit the link in the description, which has everything you need to know about leg spider vein treatment. I look forward to seeing you in my next video.